Cancer is the name given to a collection of diseases. In all types of cancer, some of the body's cells begin to divide without stopping and spread into surrounding tissues. Do you know 10 million of people around the world die each year from cancer? And the common 5 leading sites are breast, lung, mouth, cervix uteri, and tongue. At Medicircle, we are conducting an exclusive series on the occasion of World Cancer Day, showcasing eminent oncologists over discussion to bring awareness about cancer, its treatments, and myths related to it. Hi, this is Sana Khan, and today in this initiative, we're going to speak to Dr. Kamlesh.D. Dr. Kamlesh.D is a BDS and MDS from Nair Hospital Dental College in Mumbai. He is now a private practicing dental surgeon, implantologist, general and aesthetic dentist, a senior consultant at Bhatia Hospital and the Asian Cancer Institute, Kambala Hill Hospital, Mumbai. He was also an ex-lecturer at VDP College, Sangli, Tehran Dental College, and was also a chairman of Exhibition Board for Final BDS students at the University of Kolhapur. He has done scientific research in oral probiotics on behalf of Tenshi India Private Limited and their role in oral homeostasis. As an ex-consultant at Hindustan Unilever Limited, Dr. Desai was instrumental in facilitating the incorporation of fluoride in toothpaste that has in itself led to an improvement in the dental caries status across the board. His valuable inputs led to AIM toothpaste, an affordable low-cost toothpaste, and the National Dental Insurance Scheme, resulting in heightened awareness and improvement of oral hygiene status in the country. He works towards tobacco cessation and is keen to be in the forefront and in the early diagnosis, intervention, and hence better cure rates in oral pre-cancer and cancer. As a student, he contributed to the oral health scenarios and the WHO summit in Mumbai under Dr. David Barnes, as chief of WHO in the 80s. He is willing to take a public stand to help in the eradication of oral cancer in particular and others in general. Please welcome Dr. Kamlesh. Hi, Dr. Kamlesh. Welcome to Medicircle.
Good evening, Sana. How are you?
I'm fine, thank you. How are you?
Very well. Stay safe.
Thank you. Okay, Dr. Kamlesh, what are the most common misconceptions or myths related to cancer?
First, it can't happen to me. That's the earliest misconception. Second is denial. Typically, somebody who's got any kind of a lump or a small ulcer in the mouth, I speak primarily in the area of the oral cavity. That's my expertise. Generally, what happens is that there's a denial. Not many people look for sharp teeth, sharp dentures, broken teeth, and think that everything will go away because it's just a minor ulcer where you can apply a little jelly or ointment. That is not on. It has to be examined by a professional and carefully assessed to eliminate, not rule in, to rule out any form of oral pre-cancer or cancer.
Right.
That is the first thing. This is the first most common myth. And second is, people think that tobacco doesn't really cause extensive damage. And that is one of the greatest myths in the world because it doesn't cause any pain.
Right.
So they have their tobacco in different forms, smoke and smokeless. They leave it inside the oral cavity and in the cheek or elsewhere below the tongue. And since it doesn't hurt, they don't need to do anything about it.
Right.
But we generally discover it in such a late stage in some situations that there is very little one can do to prevent disfigurement and often very early death.
Mm-hmm. So early diagnosis is very important.
Yes. And that's in some people actually also believe tobacco doesn't kill.
Right. Dr. Kamlesh, does cancer have symptoms or is it asymptomatic?
Well, actually, it's a combination of both. In the very early stages, it just starts off with as a small little irritation. For instance, if you take your hands and you feel a thickening on your palms, you just think, oh, that's really nothing, it doesn't bother me. And so you don't do anything about it. Right. That's the first stage of early oral pre-malignancy. We call it pre-malignancy or pre-cancer, where the irritation in itself results in the oral cavity in a little thickening of the cheek or a thickening in the area of the tongue and very mild discomfort which disappears and people continue going about their lives including some of their habits like tobacco and alcohol. All these result in the beginning of the seeding of cancer, where it is only on the surface, can be caught early. There are some that can frankly start off as slightly or mildly painful and go on to being deeper, very painful if they hit the bone early or hit certain teeth and therefore affect the nerves from around the teeth.
Okay.
Tongue cancers are predominantly initially very, very painless, as almost all other soft tissue cancers in the oral cavity. Unless there's a nerve, a major nerve that gets touched, they do not initially cause pain or cause pain for a very long time. And it is discovered sometimes on routine examination, and sometimes only when the patient complains of a foul smell, a foul odor, and somebody notices that there is a slight swelling, and that's when it all comes into play. And by then, actually, it's, you sort of, the horses have already bolted from the stable.
Right. Okay, Dr. Kamlesh, with the passing years, there has been an increase in the number of cancer cases. According to a study in India, with a population of 1.35 billion, witnessed as many as 1.16 million new cancer cases and 7,84,800 cancer deaths in 2018. Sorry. What are the reasons and how can they be controlled?
Actually, I'd like to partially correct your statement.
Okay.
There are at an average 8 lakh new cancer patients being admitted and diagnosed at only the pioneering Tata Memorial Hospital in Mumbai and its branches. Only in one of the hospitals. I would think that this is just a tip of the iceberg, where so many are not even being diagnosed or treated in different manners all across the country for the lack of, for economic and other reasons, and by alternative medicine, that it becomes too late, and therefore there are many large numbers there. Your question again, what are the reasons for?
Sorry?
Your question again, what did you say was your question? What are the reasons?
What are the reasons and how can they be controlled?
Well, the first things first, I think tobacco is probably the singular large reason for our problems. Right. Today, cancer among women has gone up by 12% because they are bigger smokers than men are. Men tend to have given it up, whereas women continue. Second, even in lung cancer. And tobacco, diet, alcohol, neglect, belief in systems that these things are the only things that work, like betel nut, quads, pan, etc., that are placed inside the oral cavity. All these are the causes, and sometimes they're not accepted by people, families, cultures. Reverse smoking, hungry smoking in some parts of the country. All these are actually old cultural habits that may have been at a point in time when there was ignorance, but now we need to spread this message so that people understand that this is dangerous for them, and it can lead to loss of life, loss of money, loss of family happiness, loss of everything there is. What can we do to correct it? I think we need bigger campaigns. We need a huge proactive government stand. And I'm happy to talk to them about it, saying you need to look at banning tobacco in a bigger way, in a much bigger way, and bringing out the impact of tobacco in all forms and cancer in all forms to the general public at every single socio-economic level. Apart from that, I must let you know that 20-25% cancers do not have any single stimulus. They may have no cause, maybe for non-smokers as well, or non-tobacco users. So a healthy oral checkup by the dentist after 40, 45 years of age is extremely important to rule out any problem. And it's a 5-minute checkup that costs very little and can spare people a lot of unwarranted unhappiness.
Right. Thank you so much.
Newspaper cuttings. Media is already doing its job. I can see ads in movie theaters and others. But I think this has to become a portal in life. And tobacco cessation as a method of, must become a big prominent way to help people get off it. And not just among those who are app users, but among those who genuinely can't afford it, but will never access the app. You have a villager, you have somebody out there, he may use a mobile phone, but he needs to be able, somebody needs to tell him that this is relatively important for you, and these are the methods by which you can give up smoking. So we would need corporate and government and specialist experts to help in creating a synergy which will help eliminate tobacco, which will reduce the rate of oral cancer and its early and we need early diagnosis.
So awareness in the rural areas is very important.
Yes, in all areas. Yes, in
Right.
rural areas in particular. Yes.
In particular, yes. Okay, thank you so much, Dr. Kamlesh, for coming to our show and sharing your valuable time and insights with us. It has been a pleasure having you on the show.
May I say one more thing, Sana?
Sure, please go ahead.
What we need, and it's probably something that's in the making and will happen in a few years, is an easy diagnostic test where you can take a spot of tissue, like in the COVID test, COVID-19,
Right.
SARS. You take a little tissue from somewhere, put it under a microscope, and actually predict and predicate the entire oral cancer sequence. This is going to be probably one of the best ways to help in catching it early, so that patients and people can be sensitized and they can be motivated to give it up.
True, very true. I hope this comes up very soon.
Me too. It's a part of my dream to help prevent cancer in the country and prevent early deaths.
Okay, thank you so much for coming to our show, sir. It was a pleasure having you here.
Thank you for having me. Thank you.
Thank you. Bye-bye. Have a good day.